Welcome to episode 35 of How Positive Are You? Our next guest is using a pseudonym, Juan, for reasons you'll understand later. He's a graduate from the College of Science at the University of Texas, who was diagnosed HIV positive in 2007 when he was taken to the emergency room for fever and night sweats. After being given morphine, doctors diagnosed him with mono, but he urged the doctors to check him for everything, including HIV. 2 days later, the doctors called and said the exam came back as a false positive. However, when the doctor learned he'd been intimate with men, his, quote, false positive was changed to a, quote, true positive, and he was quickly talked into taking AIDS drugs, which he did for 6 months. It turned out that the night sweats, classic symptoms of pre-AIDS or AIDS-related complex, were due to a rupturing appendix. Due to late diagnosis of his real medical condition, he ended up in the hospital for 3 weeks with multiple scars from the surgeries. After he began to work in his field of clinical research, his mind was opened when a co-worker told him that during a clinical trial, a subject was cured from type 1 diabetes, and the next day the study was canceled and the drug shipped back to the pharmaceutical company and all records shipped back or destroyed. Knowing how clinical research worked, he looked into the clinical trials of the AZT-like drug he was taking and was shocked to find out that AZT didn't go through the proper phases of clinical trials. For example, they were never given to healthy subjects to truly assure the safety and effectiveness of the drugs. He began to do research following the trail set by many well-known dissidents. The book that changed his life was a book called 1 Minute Cure, which advocated hydrogen peroxide therapy, which he believes detoxed the AIDS drugs from his system. He now believes that HIV is a scam. We'll get to our guest in a minute. I'm here today with my co-host, Terry Michael.
Hello, David. Welcome to you and to our guest. I'm sitting here in Washington, D.C., in these, as I call it, 10 square miles surrounded by reality in the United States of America. And I'm very pleased to once again have another great guest on How Positive Are You? Before we begin, though, David, do you have any feedback from our listeners?
Yes. I've got a little bit of feedback via Facebook. One comment was regarding the Professor Marco Ruggiero interview. Excellent. Ruggiero presents expertise tempered with modesty, good humor, and scientific rigor. Another commented on the Joan Shenton podcast. Another great podcast. I'm excited to hear about her new video. Brian Carter, that many of you know, commented on the Maria Gonzalez podcast. That was a very good talk with Maria. Thanks to you and Terry. We also got a feedback on the Marco Ruggiero podcast from Dr. Serena Enderlini at the University of Puerto Rico. I really appreciated your interview with Dr. Marco Ruggiero in all its parts. As someone who has an expertise in Italian culture and politics, she wanted to comment on our podcast, and she commented on our discussion of sexuality. While it is true, she says, that Italian publicity styles are more liberal in the use of male and female bodies to sell products, and that people are less paranoid about the exchange of fluids, I don't really think it's wise to believe this amounts to more sexual freedom overall, and most of all not on account of the current Prime Minister Berlusconi, who I personally like to describe as a mini Bush. Berlusconi's sex liberalism only amounts to corruption. If you're a young woman with the right bodily attributes, he will make you a minister in exchange for sex with him. And she goes on to an interesting discussion of sexual politics in Italy. We also had, finally, had a comment from a man in England. Hi there, David and Terry. This show with Marco Ruggiero was good. We need to take a stand. I was talking to Dr. Christian Fiala on the phone, and he said the HIV tests mean nothing, and to go to the homeopath doctor and treat the symptoms. Researching for yourself is good. So those are our feedbacks for today.
Excellent. Okay. Well, let's, since we're talking to a guest who doesn't want to, for understandable reasons, use his real name, let's begin by asking you to begin to tell your story for us. When, let's set a timeline on this, as I always like to do. When did you get this test that began to change your life?
Okay, first of all, David and everybody, I want to say it's a huge honor, highest honor. I'm very familiar with your work, and I know you've had guests before like Peter Duesberg, Joan, the people I admire the most have been on this show. So thank you so much for giving me this opportunity. And I guess this first started in 2007. I was an undergrad in college, and I was close to graduating. It was my last semester, and it was during the summer when I just started getting sick. And I went to the hospital. I had flu-like symptoms. I had night sweats, and I went into the hospital, and they pretty much ran some tests, and they came to the conclusion that it was probably mono, what I had. So they gave me some morphine, and I went back home, and before that, I urged them to run a whole bunch of tests, everything possible. And they told me that 2 days later, because I had also specifically requested an HIV test, and the doctor called and told me that it was nothing to worry about. He just wanted to call me and tell me that it was there was a reaction, but it's what's called the false positive. And back then, I didn't know there was such thing as false positive. I was familiar with HIV, and I did volunteer at the AIDS Foundation, the local AIDS Foundation. I was a member of a fraternity, and we would volunteer there pretty constantly. And, being a science major, it was written in black and white there, HIV causes AIDS, and we were familiar with the Western blot and the ELISA testing. And during college, they tell you specifically, oh, these are very accurate. There's no way there's a mistake and stuff like that. So for me to hear false positive, I was kind of thrown back, but I was relieved at the same time. However, I went 2 days later, I kind of, what the doctor called relapsed, and that's when I told him specifically, he asked me certain questions, and I answered honestly. And he asked me if I had ever been, what would put me at risk or whatever. Was I into drugs? Was I intimate with the same sex? I'm like, well, yeah, I've had experience with the same sex. So then they ran some more tests, and then 2 days later, I go back into the hospital, and that's when the doctors told me that, oh, we ran some more tests, and your test came back positive.
Let me interrupt you here just 1 second, Juan. So that first test that you had that they called a, quote, false, unquote, positive, was that the ELISA?
Yes.
So they had not done, by that time, a Western blot?
They must have had a negative Western blot. I think the only reason they would have called it a false positive is if the ELISAs were positive, and then they ran the negative blot, the Western blot, and it was unreactive.
Well, I'm not sure. Is that the case, Juan? Was it just an ELISA, or had they run a Western blot?
Well, as far as, then at the time, they did what was called they did the Western blot. So, at the time, I didn't even know much about the Western blot. I just know that it was a confirmatory test, and there was no way of it being, it had to be accurate. That's what I was taught. But now that I'm looking back at it, I've been kind of investigating, who was the doctor that diagnosed me. And they told me it was this one doctor. So when I call him, he doesn't want to take the responsibility. And as far as I know, there's only one record. And I went to the AIDS Foundation here, and all they have record is that Western blot. There was one Western blot that was taken. They said that it would have been too expensive to do another one. I can't find any record of an ELISA test being done. So as far as I know, there's only one Western blot that was done, and it was that one Western blot that they used to say I was false positive.
Well, that's a very highly unusual thing, because normally they would only do an ELISA before they did a Western blot. At least
I suspect that they did, but they just didn't keep the records.
Yeah, that's what I'm thinking. And but still, there's no record of that. And what puzzled me more was that the Western blot, they told me straight up, like, oh, no, it was only one Western blot done because it's too expensive to do another one. So that's what, kind of like struck a chord in me. Why would the results automatically change based on what I told them? You know what I mean?
Right. So you were positive by being gay, or positive by having sexual experiences by men. But had you told them you were heterosexual, they would have continued to believe that, or continued to assert that you were false positive. Correct?
Exactly. And see, now that I know what I know, it's really clear that anything can trigger, I guess, a false positive response in these tests. especially, anything like the common flu, to mono, or even appendicitis, I was told.
Let's clarify here what we mean by false positive. All we mean here by positive, first of all, is reactive to a set of proteins that are supposed to be specific to antibodies, that are supposed to be specific to an antigen that is supposed to be a pathogenic retrovirus that the world decided to call a human immunodeficiency virus. It's very difficult here for most people to get their minds around what this positive means. The best word really is reactive. You reacted. Your blood had some proteins in it that made this test light up. And whether it's false positive or a real positive or is not really relevant. It's that you were reactive to a set of proteins. And then they decided, because they thought you were straight, to say you were a false positive. And then when they found out that you were not, they decided you were a real positive. In other words, it was all made up.
Right. I'm pretty certain that they did the ELISA because that's standard practice, and if there's one thing medicine is good at, that's doing standard practice. And normally, they will do 2 or 3 ELISAs. The first one is considered the screening ELISA, and if that's negative, you go away. And if the first one's positive, they do a second, sometimes a third, often with a new blood draw. And if one or both of those are positive, then they do the Western blot. Now, if that turned out not reactive, then they would have said, okay, it was a false positive. If they had actually done the Western blot by itself, that would completely surprise me. But on the other hand, nothing surprises me.
What I came to learn also was the doctor that diagnosed me, or the one that supposedly diagnosed me, he's not an infectious disease doctor. So I called in to ask him basically, what's your criteria for diagnosing somebody? And of course, this was 3 years ago, and he really didn't remember me. I guess he looked into the records, and he's saying, well, I don't know why your test came back strongly positive. And he left me a message, of course. And he said that he would understand why it would be so falsely positive, so strongly positive, if right now I'm claiming that I'm negative or what have you. Because one thing I've been doing also, I've been testing myself, and the 3 times I've been tested, I come back negative.
Oh, so you've actually had subsequent tests then? How long after
I have.
that
Well, I go
test?
do the rapid HIV test at clinics here and there. I mean, of course, I don't tell them that I'm positive. I mean, they ask you, have you ever tested positive and this and that? And I'm like, oh, well, no. So I have never had, one thing also, I've never had a test turn positive right in front of me also. I mean, most people also have taken tests and, they're in the room and, 2 lines light up, or however the test is designed, it turns positive in front of them.
How many negative tests have you had since that first, quote, positive, unquote, test?
I've had 3, because I used to go get tested at the university where I attended, but they stopped doing that, and now you have to be a student there.
Okay, well, let's go on here and ask you, okay, what was the next step? What did the doctor then do? Did they then try to do a CD4 T-cell count? Did they then try to do a viral load count?
No, they did nothing of that nature. All they did was tell my parents that, nowadays, it's not a death sentence. All you have to do is take 1 pill a day, and that's it. So he kind of just left me on my own, Like I said, he wasn't an infectious disease doctor. He was just a surgeon, as far as I know. So I kind of went to the local AIDS Foundation and kind of got counseling there. And what they do is a program that kind of helps you, counsels you, has programs set up, to get you on the right track. It's a nonprofit organization that sets you up with doctors and stuff like that. So they set you up with Ryan White, with a triplet assist programs, what have you. They offer a lot of services to HIV positives.
So are you telling me that you actually started taking the drugs before there was even any testing of your CD4 T-cell counts or your so-called viral load?
Well, no. After I went to the San Antonio AIDS Foundation, they set me up with a doctor, an AIDS doctor here. And that's when he ran tests. My T-cells were at 205. My viral load was 49,000. Relatively, he told me that was low. That normally, a lot of AIDS, quote-unquote, AIDS patients have viral loads in the millions. And the T cells, he said, were really, the number was too low.
Did you have any presenting illnesses at that time? Were you sick at the time that you took that test? Did you have any illnesses?
No, I wasn't. I mean, I was maybe a little bit weak because I was in the hospital for 3 weeks. And that's one thing also, you know, the doctors were too busy just saying, oh, he's positive, this and that, and boom, my appendix ruptured. So that could have been prevented.
Right. So let's go back a little bit. You had appendicitis, and your appendix ruptured, which is a pretty serious issue, right?
It is, yes. And I didn't have any pains on my side. So, I mean, I've heard that it can happen where you don't have any pains on your side. You know, they were there pinching me, or does this hurt, does that hurt? I'm like, no, it doesn't.
But do you think that all of your symptoms, like fever and stuff like that, were related to your appendix blowing up on you? I mean, did it happen just before it ruptured?
Yeah, right before it ruptured. That's when I was having the symptoms. And the last day I went in, when they told me I was positive, they also looked inside my stomach, and they saw that there was swelling. So they prepared me for surgery the next day. But as soon as the anesthesia kicked in, that's when it ruptured. I was lucky in the sense that I was asleep when it ruptured. And when they cut me open, there was already all this fluid everywhere.
Oh, God, yes. So, I mean, that's pretty amazing that you had classic AIDS symptoms in terms of early AIDS, you know, the fevers, the night sweats, things like that. And it was all explained by appendicitis. It seems like the most reasonable explanation for this. But also, like, if your appendix had been leaking, you would expect your body to be generating antibodies to all of the toxins that were being leaked into your body. So I guess a false positive at that time would make a lot of sense.
Or reactive, again, as I want to call it, because
reactive,
implies that there's something positive about the determination that there's a virus causing a health problem. Had you, now, just so I don't misunderstand, had you started taking the antiviral drugs before the appendix ruptured?
No, this was way after.
Afterwards.
This was a couple of months after I went to the local AIDS Foundation. And I got set up with a doctor. You know, a couple of weeks later, I was there in a clinic, and I just remember having this feeling of, you know, it's just, you know, you grow up, you know, fearing AIDS and HIV, then all of a sudden you step into this community you never wanted to be a part of, you know what I mean? So it was just something that just really hit me hard, and that's when the doctors, you know, gave me my viral load, they gave me my T cells, and when he saw that my T cells were in 205, that's when he told me, you know, it's good idea to start taking these drugs. And he presented me a list of all the possible drugs, you know, a triplet, Truvada, you know, anything from like 2 to 4 or 5 pills a day, take 2 in the morning, 1 in the afternoon, 3 at night, different combinations. And, you know, I remember just looking at them and thinking, you know, I wouldn't want to have to do this for the rest of my life, but it's what I had to do. I mean, I was scared, you know, like everybody is at first. You know, you're scared, you're terrified, and I kind of went with the one that I thought was easier, which was triplet, you know, taking it once a day. I felt I could live with that. And so it was maybe about 2-3 months after my initial diagnosis that I started taking the ARVs. And within that time, you know, I was also healing from this major surgery I just had. You know, I have like a 6-inch, you know, slash on my right hand abdomen, the right hand side of my abdomen. On top of my belly button, I have another 2-inch gash, and then on the side, on my left side, also I have a couple of cuts there too. So I had to take all my organs out and kind of clean under there.
Wow.
You know, and then kind of put everything back in there and just staple me up.
Before we proceed to ask Juan what happened then after he started taking these drugs and how they affected his health, let's point out to listeners that CD4 T cell counts, this is cell-mediated immunity, white blood cells. These counts, lots of research has shown, is that when people are very ill, they can have very high CD4 T cell counts, which by the HIV equals AIDS industry means they're in good health. Long runners, highly trained athletes can have very low CD4 T cell counts, which the HIV/AIDS industry tells us means you have the potential for illness. So the CD4 T cell counts are a very nebulous marker for any kind of disease or wellness. So let's go on now, Juan, and ask, once you started taking these drugs, how did you start feeling? How did they affect you?
Well, let me tell you, the first time I took it, I mean, it was like this awful, I can't explain, like a vertigo, wrong feeling. I remember I took it downstairs, and when I went upstairs, I almost passed out. You just have like this feeling like everything is just spinning around. And, the doctor kind of warned me about that. It'll be a while before your body, gets used to it. But, shortly after that, like I started having the diarrhea, the chronic fatigue. I had just graduated college when I first started taking these drugs. I was, like I said, I don't know if I said, but this was like around 2007. It was in July when I got diagnosed, and by December I was already taking them. And when I started taking them, I started having these adverse reactions to it. The side effects. I started getting the drunk feeling, the nausea, the fatigue, the diarrhea. It's just like my whole world like just turned upside down. And of course, naturally, they blame the disease. They don't blame these drugs. And then my doctor encouraged me to go see a nutritionist, which I did. And she told me about probiotics. And she gave me a meal plan, basically. So that's what they do nowadays. I mean, I guess I'm part of a new generation of this whole, like, HIV mess, I guess. Now they tell you to, watch what you eat. They tell you about acidophilus or probiotics, which are the good bacteria in your system.
Right.
They kind of give you a regimen on exercising. They check your body fat, your body weight, and stuff like that. I don't know if this is just exclusive to my clinic, but
well, it makes sense.
That's what I was told.
Right, it makes sense because these drugs are potent antibiotics, and so they wipe out the good bacteria in your intestine. So probiotics make sense. I mean, if the drugs were doing some good, it would all be a very intelligent thing to do. And maybe it's a quiet admission that these are very damaging to the intestine.
Yes, what you have here is a doctor giving you a toxic chemotherapy that's causing diarrhea, which is causing you not to be able to absorb nutrients. And so then the very illness that the doctor has created, he's giving you then probiotics to try to counteract the illness he created in your body with the toxins.
Right, but did anybody tell you, did your doctor or anybody tell you about the side effects of the drugs in an honest way, about what they might do?
Not in that sense. He just said it'll take a while before my body gets used to it. You know what I mean? At the same time, if you just learn, growing up especially, you're just taught, to pretty much, believe the medical community. Doctors are this and that, you know what I mean? They're good people, they want to help you and all that. And some doctors have good intentions. I believe my doctor did and still does. Whenever I started, educating myself on, rethinking this whole AIDS thing, I asked him if he was familiar with the work of Peter Duesberg, and he had never heard of him. And I asked him about Robert Gallo, and he never heard of the name Robert Gallo either.
That's amazing.
So I'm thinking, okay, you came into the world of AIDS, and how much do you know besides,
It'd be like teaching evolution and never knowing who Darwin is.
Exactly.
It's crazy.
And I told him, how much do you know about this world before you came into working? And one thing about doctors, because, I'm also a science major, and I worked with pharmaceutical companies. I worked with doctors as well. And in the 3 years, or 2.5 years, I did a clinical research. Going back a little bit, after I graduated and started taking these drugs, I started applying for jobs. I landed a job as a clinical research coordinator with the diabetes, or it was more of an endocrine clinic. We did diabetes, we did neuropathy, we did hypertension, you name it, anything having to do with endocrine. And, and I started getting the protocols. And what kind of threw me back a little bit, each protocol, it kind of gives you the objective there. And the objective was always, the type of the the purpose of this study is to regulate, type 2 diabetes or hypertension, always regulate or stabilize. It was never cure.
Right.
So that's kind of what threw me off a little bit. I'm like, okay, why aren't these companies, working to cure? That's what I went to school for. That's what I, studied for. I wanted to see a cure for AIDS, for cancer, for everything in my lifetime. You know what I mean? And that's why I studied hard to get into this and try to find solutions for this.
How long did you take these drugs before you decided that they were doing you harm and stopped?
I would say a good 6 months. I mean, working in research, it just opens your eyes so much. Because you get to see how pharmaceutical companies work and how much money is thrown in there or thrown around. I mean, for a drug to get approved by the FDA, they have to go through 4 phases. After the animal testing, of course. They test the drug on small animal, little animal, being a rat and a monkey or a guinea pig and a gorilla, whatever. And then that's when it goes into human trials. So in phase 1, they test it on the healthy people. And these are people who are healthy, so their main benefit is just the money. Some studies pay up to $7,000, to lock somebody there for a week and just give them the drug and then take their blood every 2-3 hours. And, they give them different dosings. Some subjects get the placebo, other subjects get 10 milligrams, some get up to 50, others get 100 milligrams. And that's how they test the beginnings of the drug on healthy people. Then they get to phase 2, which they test on non-healthy people. So in that case, I was doing a diabetic study. So in phase 2, that's when you get the subjects that have the condition. In that case, it was diabetes. So you get to see if the drug really lowers the blood sugars or not. And then in phase 3, that's when they basically take the drug home, and you see them maybe once a month or once every 2 months, and they come into the office and you refill their drugs and you draw their blood. And then in phase 4, that's when you get to see them maybe once a year or twice a year. So it's a long process. It takes about 10 to 15 years for the drug to go through all those phases. And when I started researching, the drug I was taking, because I was concerned also, I was thinking about what I was putting in my body every day. Because, like I said, the side effects were horrible. I was getting fatigue, I was getting diarrhea, I was getting nausea, I was getting the fatigue especially. I almost lost my job a couple of times because I could not get out of bed. And I kept on telling the doctor, I feel this, I feel that. And he kept on saying, oh, it's the virus, it'll get under control soon, but it's what you need and stuff like that. So on paper, my T cells were like, 900. My viral load was undetectable. But what kind of bothered me was, okay, why do I look so good in paper, but I feel like crap?
Right.
I couldn't understand that. So the more I started looking into, I guess, a triplet and AZT, the more I realized, these drugs are, it started off as a chemotherapy. Now they're modern-day poison. What's so good about it, and why are the T cells going so high? And that's when I started researching Christine, what's your last name?
Majori,
yes. And a friend of mine, he's also HIV positive for 10 years, and he's never taken drugs, so I was wondering why he was doing so good. And so he gave me that book, and he kind of made me figure it out on my own. And that book also just totally changed my life as well. And that's when I started doing extensive amounts of research. And YouTube, had a lot of information on there. That's when I first learned about the documentary House of Numbers.
right.
And I started learning, the reason why these drugs are the reason why I feel like this is because of these drugs, not because of the virus. I couldn't find a documented case where, this virus was, causing AIDS. You know what I mean? That's what we're told, especially in medical school. I have it in my textbooks there, black and white, HIV causes AIDS. And the more you started questioning, why does this virus, how can this virus cause, the depletion of the body completely, and you also, want to question everything, what's going inside your body, what are you putting in your body. So the more you start to question things, the more you get the more you want to learn.
Right, and there's so many contradictions. Like, they always talk about CD4 cell counts, and if you show up like you did with a CD4 count below 500 and you're HIV positive, then they're going to want to put you on the drugs. I mean, the number exact cutoff varies from time to time. But if you were to show up, say, with Kaposi sarcoma, a gay man, and your CD4 count was 2,000, they'd still diagnose you with AIDS. So they don't care about the CD4 count if it's in their interest not to care about it.
Tell me what happened with your medical provider once you decided to go off the drugs. Were you seeing the same doctor? Did he or she try to get you to stay on the drugs?
He did. He tried to get me to stay on the drugs. I mean, for the most part, he told me that a lot of his patients are doing very well. But, when you look at his patients, a lot of them are very tried up looking. I just didn't want to look like them. You know what I mean?
And by dried up looking, you're probably talking about the lipoatrophy, the wasting of the face, and
that's
kind of
exactly what they look
look.
like. I didn't want to look like that. So, with working where I work and with doing the research I did, I kind of came to a conclusion when I told him, and I even gave him a copy of this book called 1 Minute Cure that I read. This one, I read it before I read Christine's book.
Right.
And it talked about the hydrogen peroxide therapy, and what kind of intrigued me about that was that, they call HIV an anaerobic bacteria, or virus, sorry.
Right.
Meaning that, it doesn't thrive in oxygen. So therefore, hydrogen peroxide is H2O2 with water with an extra oxygen atom. So when you oxygenate your body, it kind of gives you, it kind of creates an environment where no virus can thrive, supposedly. And I like the concept of that, and I agreed with it. I gave it a lot of thought before I thought about, putting this into my body. And I gave it more thought than when I decided to take a triplet. So I took the doctor a copy of that book, and he said he would read it, but I told him I was coming up the drugs. And he said he wasn't too happy about it. He's a very good doctor. Didn't get after me at all. I've heard horror stories about other doctors.
Mm-hmm.
But the thing about the medical community, and working in research, what I come to learn also is that, a doctor's only form of solution is to prescribe pharmaceutical drugs. Other doctors who have maybe prescribed anything natural or anything like that have lost their license.
Right.
There's a very good doctor based out of San Angelo, Texas. His name is Dr. Hines. And he runs a clinic called Hope Clinics International. And on his website, he says that he has a clinic in Acuña, Mexico. And the reason being is because in Mexico, they allow other therapies, and in the United States, they don't allow. And there was a quote on there that said, according to the Wall Street Journal, it takes about a pharmaceutical company has to pay $100 million to the FDA to get their drug approved. And that takes about maybe 15 years. And in those 15 years, people are dying of cancer, they're dying of AIDS. And I remember I sent him an email, and he responded to me, and he actually asked for my phone number, and he called me, and I spoke to him on the phone. And he said that he is very familiar with therapies like that. We talked about colloidal silver. We talked about many natural products like cat's claw, party argo, which are antifungal, antibacterial, bacterial immune boosters. And he told me that he administers the hydrogen peroxide intravenously, and that he'd be glad to help me if I went to Mexico. But at the same time, I could also take it internally. And he just suggested that maybe I take some iodine also for the immune system. And we had a chit-chat on there, and he told me why he has to go to Mexico to do a lot of these procedures. That was because, the FDA won't allow this here in the United States to lose his license.
The reason, let's introduce a term here for our listeners, both new and old. What we've been talking about here is allopathic medicine. Allopathic medicine, for the last 100 or 150 years, is a kind of medicine that says, under 19th century Louis Pasteur germ theory, that a pathogen, a bacteria, a virus, a fungus, is what causes a disease, and the way a physician treats that disease is to put a chemical in your body to kill that bacteria or that pathogen. There are other schools of thought that say, no, that's not the way we deal with a person's healthiness. The way we deal with a person's healthiness is to consider the terrain of the host, that is the human body. Is the human body healthy enough to resist these foreign invaders? So what the other side of medicine says is, let's keep a person healthy by boosting his natural immune system, and then these bugs will not be able to do their work, will not be able to invade. In fact, there's a famous quote. Louis Pasteur on his deathbed said that, I can't remember his intellectual opponent's name, but he said, let's call him Charles, was correct. The pathogen is nothing. The terrain is everything. So it's two schools of thought. But Western medicine is the kind of medicine that your doctor, Juan, was practicing. He said, you got this bug in your body, so we have to zap it with a chemical.
The magic bullet approach.
Exactly, and that's the way they're trained. You know, their solution is always a pharmaceutical drug.
And
so,
speaking,
maybe the doctor doesn't know anything else about,
right,
anything holistic or natural or stuff like that. And another thing also, one thing I also realized that it's also a liability. You know what I mean? If I get sick with the pneumonia, I'm already diagnosed HIV positive. I have a plus sign tattooed to my forehead. So pneumonia can hit anybody. And if for some reason, I end up in the hospital sick and I'm not on drugs, then it's going to go down on him. Who is this guy's doctor and why isn't he on drugs? You know what I mean? So it's also a liability to him also.
Yeah, I heard a doctor talking about what he called defensive medicine. I thought I got it mixed up with preventive medicine, but he said, no, defensive medicine is where you recommend that somebody gets, for example, a prostate-specific antigen test for prostate cancer, even if you don't believe in it, and there's a lot of evidence that they're useless or counterproductive.
Exactly.
But you go ahead and do it, because if the guy gets prostate cancer and there's nothing on the record saying that you advised him to get a PSA test, you're in line for a lawsuit. And I'm sure the same is true in spades with AIDS. And in particular, with AIDS doctors, what's an AIDS doctor going to do except prescribe drugs? That's about the only tool that they have.
And I told him, I'm like, you want me to sign something, a waiver saying that I refuse the medication? And I started this therapy. I was honest with him. I told him, this is what I'm going to do. I'm going to go by what this book says. I just ordered some, hydrogen peroxide. It was 35% food grade. I'm going to do this. And I did that for 6 months, and I'll tell you, it was something very intense at first, because, as you're detoxing, you do get these flu-like symptoms. Everything that the book said was happening. It got to the point where, I was thinking, am I doing the right thing? And I got to the point one time when, I was having this horrible flu, and I literally had the triplet in my hand, and I was ready to just take it and go back to the ARVs, and thank God I didn't, because, after a week, these symptoms disappeared. And it's been about 3 years now, and I've never gotten the flu ever again. And not even a common cold. It just...
Speaking of these drugs, just for our listeners' benefit, a tripla, it's, as you might guess from the name, is a combination of 3 drugs. They're
exactly 3 drugs, yeah.
Emtricitabine, which is a nucleoside analog. It's an AZT-like drug. Tenofovir is a nucleoside analog-like drug. And efavirenz is a non-nucleoside reverse transcriptase inhibitor, which is the same class of drugs as nevirapine. And I think the major reason these combinations often don't have AZT in them anymore is because AZT's gone off patent. And obviously the first 2 nucleoside analogs are new drugs. There's a nice long patent life, and there's a lot more money in patented drugs than unpatented drugs.
Yes, and I haven't had any single side effects, all these symptoms I was having that they were always blaming on the virus, I haven't had them anymore. So it's clear, that if the drugs that were doing this to me.
That is a really important observation. The very fact that you got well after you stopped taking the drugs and you didn't have these symptoms that your doctor blamed on HIV is just demonstrably the reason, a good
it is, and it's very
basis for understanding
it's very also frustrating and upsetting, because I see a lot of people going through this, and they're just convinced that it's the virus, and I'm telling them it's not. And most people who go against this, they're people who are not they're people who are not HIV positive themselves. You know what I mean? they just go to an AIDS clinic, take an AIDS test, pick up a pamphlet, and all of a sudden they think they're experts on this. You know what I mean? And who's making those pamphlets? Pharmaceutical companies who want you to take these drugs. And it just goes back to doing clinical research. What I realized, these companies are not out to cure. They're out to stabilize.
Right, there's
and
a lot more
now the
money
reason
in
why
that.
they tell people to watch what they eat and stuff like that is because they want to keep HIV patients alive longer. That way they could be paying the $1,000 a month, to keep them alive. But at the same time, they're still taking this poison. They're trying to counteract that with the probiotics, with the exercise, with the healthy eating and stuff like that. And I've told them before, I guarantee you stop taking these poison drugs, you're going to get better in matter, the minute you just start detoxing off of these drugs.
Do you think that you had symptoms that were like withdrawal symptoms? Like, do you think the AAA had addictive properties?
Well, I mean, that started you're saying like something addictive, or?
Well, some people have said that some of these modern AIDS drugs are addictive, and if you just stop them cold turkey, you will get symptoms of withdrawal, which can last, quite a long time and be quite horrific. Like mental symptoms, like you described, can occur after you stop.
I don't think I did, but I mean, because at the same time, I was detoxing with the hydrogen peroxide therapy. So I mean, I did feel like I did have the intense flu-like symptoms.
Right.
And I got to the point where I just, like I said, I had the triple in my hand. I was going to take it, but It's not because, it was like an addictive feeling or withdrawal. It was because, I just felt so sick that, I questioned what I was doing. You know what I mean?
And you were only taking these for 6 months. I think the people who've been taking them for years may have some withdrawal symptoms, but I doubt if 6 months of poison would probably have given you withdrawal symptoms.
Well, 6 months of heroin would probably be enough to get you hooked.
I think this is worse than heroin, but I don't know. I've never done heroin, by the way.
Yes.
But when you come down to it, like I said, working with research, you just tend to question everything. You get to know the way the system works behind the scenes, which a lot of HIV people don't know. You know what I mean? What goes on behind the scenes. And the more you look at it, like you mentioned in the bio, when I started working there, one of my coworkers told me that there was a study that actually cured type 1 diabetes in the subject. I remember getting all excited and thinking, wow, where's this drug? Why haven't we seen it? And he kind of giggled at me. Actually, him and another coworker giggled at me, and they're like, oh, Juan, this is a business. What makes you think these pharmaceutical companies want to cure people? It's, if you look around, look at how many diabetes doctors there are, how many nurses they have, how many staff members. Same thing with AIDS. How many AIDS doctors are in this country? How many of them have nurses? How many of them have staff members? If they cured something like that, millions would be out of a job, kind of like the way it happened with polio in that industry. That industry just died overnight.
Right. There's a very funny YouTube video about the day they cured AIDS, and there's have you seen that? Yes. There's a couple of AIDS workers in the storeroom packing up boxes.
And I guarantee that would have happened exactly at my diabetes clinic if that would have been the case with diabetes. I'm pretty sure that would happen everywhere because these people depend on this. How many organizations are out there? How many celebrities sponsor this? It's the whole world. You just can't let it die off like that. So their way of thinking is just, by stabilizing, we keep them alive, but we also make all this money, and we also have all these people employed. Because these pharmaceutical companies, for every dollar they spend, because I read somewhere that, it just takes like $5 or $10 to make a whole bottle of AZT, but they sell it for thousands of dollars through a prescription. So it's just like any other corporation. For every dollar, they want to make $1 million.
That's why we have AIDS in Africa, because we have white Western medicine men coming telling black Africans who are victims of nothing more than malnutrition, unclean drinking water, malaria, tuberculosis, fear, anxiety, depression, that they have AIDS, and so they need to take these drugs for life. So old diseases just become AIDS so that the drug companies of the world can sell their products or have them purchased by governments for unwitting black Africans. Let me ask you a question, Juan. Now, you went through an HIV positive test. You started taking the drugs. You went off the drugs. You saw how they were hurting your health. Have you tried to talk with gay men or any women who have been on these drugs for years and tried to urge them to get off the drugs?
I tend to use myself as an example. Me and another friend of mine, we just try to use ourselves as an example. I mean, you've seen my pictures of David. I'm chunky, I'm fit, you know.
Right.
I'm not skinny, I'm not dried up. You know what I mean? I'm actually struggling to try to lose some weight here.
Right.
So that's the first thing I tell them, I show them, you know what I mean? I try to use myself as the example. I mean, I'm not a licensed professional, so I can't technically tell them, to get off their drugs, but I offer them that. I kind of offer them, or tell them that they have a choice to make.
I'm curious if what kind of reaction you've gotten. If you've actually had conversations with people, do they say, "Oh, you're crazy, this is saving my life," or do they listen?
A little bit of both. They listen, but at the same time, they're scared to death. They're scared to death of, first of all, what their doctor's going to say, of how their labs are going to come out. It's all about the numbers.
That's House of Numbers. That's the reason Brent Lynn called his film House of Numbers.
Exactly. And it's all about the numbers, really. I mean, T cells for me, right now, they're at 200. And that's normal for me. I came to realize, well, that's normal for me. I don't have to have them at 1,000 or 500 plus. That's just normal for me. I've done research where I've read, like David was saying, there's, athletes, there's bodybuilders who have T cells, like, below 200. I don't know how they came up with this number, and I've read throughout the years that the CDC have changed these numbers around.
But let me tell you, nobody knows where those numbers came from. I have asked the NIH. I have asked a physician working on the HIV AIDS question for 20 years at Johns Hopkins University. Show me the studies where we came up with these, quote, normal CD4 T cell counts. Show me the studies of what is normal
exactly.
for
and
a
that's
gay
what
man.
I want to see.
I
want to see proof of this and proof of that. Especially me, coming from a medical background, having a degree in science. I just want to see for myself, where's all this information coming from? And it just leads me to a dead end. I was my brother and I were trying to look for, the clinical trials for a triplet, and we couldn't find them. We couldn't find, at least on the internet, when they were given to healthy subjects. And that's a big part of clinical research. I have to go to the phase 1. And there's all these studies, where like, oh, if you're HIV positive, come try this study. It's, Truvada in addition to this, but you have to be positive. I mean, why can't you just, if these drugs, are safe or whatever, and then give them to healthy people. Let their body tolerate it first. But no, because they know how poisonous it is, they don't want to, I guess, risk any healthy people. And the thing that bothers me also is the vaccine. You know what I mean? Antibodies are good for our body. But when it comes to HIV, they treat the antibody completely different.
Yes.
And that's another thing why they probably don't have a vaccine for it, because, if I have an antibody and someone who's negative, goes and takes the vaccine, well, they're going to carry that antibody with them. So how can they tell who's infected or who's not?
Yeah, I've never quite figured out how they're going to come up with a vaccine that doesn't make you HIV positive, and they don't seem to like to talk about that.
Exactly. So this is the only virus, illness, whatever you want to call it, where they actually use the antibody against you. And it all comes down to how much you know. Like I said, most of my friends that I've talked to, I've tried to, like I said, I put myself as an example, but they don't know the history of this. They don't know. They don't question medicine. They don't question the medical community or anything. They just do as they're told. And I've always told them, take control. You know what I mean? Have the power in your hands to just don't be afraid.
And the other thing is the medical community doesn't question anything. Doctors are not medical scientists. Yes, there are some research doctors. Doctors are people who read textbooks. Let me finish. Doctors are people who read textbooks, and they are told, here's the received wisdom. You just spit this out to your patients. Don't think about it. We've all decided by consensus that this is best practices. Just do it. And they never look into anything. Like you were trying to educate your doctor, didn't want to hear it. He just wants to do what best practices tells him to do without even thinking about it because he might be sued.
Well, if I can say one thing about CD4 counts, I came across this remarkable paper from 2008, and it's a comparison of mean lymphocyte, this white blood cell counts, among human immunodeficiency virus negative Senegalese men and women. So when they looked at the CD4 count, and they looked at the statistics, without giving the exact details, the statistics indicated that 13.6% of men, that's one standard deviation for the statisticians out there, can be expected to have CD4 counts between 380 and 46. Okay, and so that includes the range for at risk of AIDS. 380 would be considered low, and 46 would be considered outright AIDS. Women had slightly higher counts, and prostitutes amongst the women had even higher counts. And other factors included that were associated with low CD4 counts were things like pneumonia and swollen lymph nodes that you would kind of affect. That you would kind of expect. But factors associated with higher CD4 counts were alcohol use. If you use alcohol, you have higher CD4 counts. Tobacco use, and I've seen this in several papers, that smoking increases your CD4 counts. A low weight meant you had a higher CD4 count. Extremely high weight, so there's all of these generic things about human beings that can affect CD4 counts, and yet if you're HIV positive, the only thing that affects them is HIV.
Exactly. And you'd be surprised how many doctors, are very ignorant when it comes to HIV. Even the people at my local AIDS Foundation are saying, yeah, it's a lot of doctors. They go around educating doctors as well. Because I went to an ENT, I lost my voice for a couple of days, and I went to the ENT, and he's like, I wrote on there on my medical history that I was diagnosed HIV positive. Big mistake now. I don't do that anymore when I go to doctors.
Right.
He just blamed it on the virus. He said that my adenoids were swollen, and it's just because of the virus hiding in there that it's affecting my vocal cords. Well, when I went home that day, I did some research, and it turns out it was just acid reflux.
Yes, this is the most amazing virus in the history of the world. It can cause anything that you can imagine.
Anything, yeah. It does anything. They blame it. It does anal damage, or what is it, anal degeneration. It does dementia. It does all this stuff. I'm waiting for all this to hit me, and nothing's happened.
A friend of mine in New York was told by his HIV specialist that his heart attack was because of HIV, that his stroke was because of HIV. It is, but they can't admit to themselves that they're poisoning their patients.
Oh, my God. Yeah, I've heard it all. It is. And so I told the doctor, I told him, hey, acid reflux. And he told me, take Nexium for the rest of your life. I told him to go to hell. I'm just like, you know what? I'm going to go home. I'm going to research something, holistic, natural. I took mastic gum, some root found in some, I don't know where, and it got rid of it in 2 weeks. So now I've never had any acid reflux back again.
Yeah, it's amazing what you can do to actually resolve small health problems, or you can treat them as the simple solution is everything's related to HIV. It's an interesting example of kind of a tautology or circular reasoning, because if you go in with a symptom and you're HIV positive, the doctor will often say that symptom's caused by HIV. But if you went into the doctor and said, okay, doctor, I'm HIV positive, guess what symptoms I have? There's no way they could tell you. So
Exactly.
What's the predictive value of knowing that somebody's HIV positive? If you have to look back and say, well, yesterday you had diarrhea, so that's got to be caused by HIV. The day before you had a bad headache, that's got to be caused by HIV. I mean, that's completely unscientific.
Yeah, so what I concluded after doing all this research and stuff like that, the drug I was taking, a triplet, it was killing all my good bacteria as well as the bad ones. That's why I was getting diarrhea, as well as getting nausea, fatigue. It was giving me the whole horrible nightmares. So I know it depletes the bone marrow as well. So according to Christine's book, and it makes a lot of sense, as these drugs are depleting your bone marrow, your body makes more T cells, and they start in the blood, and they start trying to get into the bone marrow. So whenever you get your blood extracted, there's all these T cells. That's why they think, wow, this drug is magic, because it's getting all these T cells. Well, the T cells that count are not in the blood.
Right.
as we near the end of our hour, I think we have found a wonderful example in Juan of somebody who almost fell into the AIDS trap but pulled himself out. And I think we should use this opportunity to recommend, David, to our listeners that they get a hold of this brochure that's published by Rethinking AIDS called The AIDS Trap. And a lot of this can be made clear via that. How can our listeners get that brochure, David?
Well, they can just go on to the website, which is theaidstrap.com. And I think the title of that brochure, I didn't come up with it, is wonderful. And they can get the brochure in English, Spanish, French, German, Russian, Italian, or Korean. And I hope we'll be able to add more languages later. It's a PDF file. People can download it, print it on any color printer, and read it themselves, give it to their friends and people they care about who might be at risk of testing for HIV.
Juan, thank you very much for being with us, and we hope that you will continue to tell your story in your community to friends, to people who will listen to you, so that you can keep others from falling into that AIDS trap.
Exactly, and it's just an unfortunate discrimination that homosexuals and black people or anybody who's at risk face. And I'm trying to get the Human Rights Campaign involved as well. And I encourage people also who tested positive, go test again. You might come negative the way I did.
Yeah, I
know people are scared. It's just something that we feared for years and years. But my advice is, you could take control. Learn what your body's telling you. One thing I hate to see is losing a lot of AIDS rethinkers. And recently, we lost a very good AIDS rethinker. I don't want to say his name. Let's call him Edward. And I spoke to his partner, and he told me that he was having lesions on his skin. And he was convinced that, oh, no, my body will get rid of it. And a lot of people who try to rethink a lot of things tend to think they're unstoppable, or tend to think that, your body will get rid of everything. And that's not the case. Sometimes, we do need help. I turn to a lot of natural herbs and vitamins and supplements to help me whenever I'm going through something like what I did with the acid reflux.
Right.
So I know there's certain organizations out there that also do tell you that, the body is one of the most outrageous things I heard was, there's no such thing as an immune system. And that kind of brought me back a little bit. This was a quote-unquote, AIDS analysis group based out of New York. But I completely disagreed with that. And like I say, we just have to listen to our bodies, take control, and don't let anybody or any drug, run your life.
And there is a lot of information out there on the internet.
There is a lot of information. I could tell you so much more, in this hour, we could talk another hour.
Yes,
and there's so much more out there.
And what you tend to tell them also is that 80% of your immune system is in your gut. And when you put that poison in your body and you kill all that good bacteria that allows you to absorb food, you're going to get sick.
You are,
Again,
yes.
Juan, thank you very much for being with us. We really appreciate your telling your story.
Yes,
David?
it was very instructive, and I think it's going to help a lot of people. Thanks so much for being on our show today.
So much. I'm just your average Joe here, and I know there's a lot of average people listening, and I hope they take control of their life. That's my message out there. I know we're all scared, but the power's in your hands.
Yeah, information is power.
Information is power. Yeah.
Yeah.
Do what you feel is right, and don't let anybody else, no matter how high his education is or how much money he makes, don't let anybody tell you what's right for you and what's wrong. These drugs are poison. I'm living proof of that, and end of story.
Thanks, Juan. And this ends our latest episode of How Positive Are You? And we hope you'll join us again.
Thanks to all our listeners, and goodbye.
Thank you. Goodbye.